Hi, I'm Dr. Art Hister, and this is your medical pipeline, and today we're going to talk about diabetes. You know, diabetes is a disease that's frustrating to me because I think it just doesn't get the respect it deserves. We spend so much time focusing on other illnesses, and we forget that diabetes is a major killer in the developed world. It's, depending upon the country you look at, it's either the 7th or the 6th leading cause of death, and unfortunately, it's rising rapidly up that list. It's going to become a more major cause of death, mostly because our lifestyles have changed so much. Kids are gaining weight, they're getting fatter. This is the first generation in history that the experts say may not live as long as its parents, and part of the reason for that is that so many of them are developing diabetes at a younger age. Now, there are two types of diabetes, as everybody should know. There's type 1 diabetes, which is an autoimmune disorder. It affects about 10% of the population. We don't know what brings it on, but it's perhaps a viral infection. Whatever the cause, the beta cells, the cells in the pancreas that produce insulin, die, and you get type 1 diabetes. You have to take insulin for the rest of your life. As I said, that's only 10% of the total cases of diabetes. 90% of the cases of diabetes are what we call type 2 diabetes. And type 2 diabetes is by and large a lifestyle disease. Yes, there's a genetic propensity, without question. A lot of people who do all the right things will still end up getting type 2 diabetes. But most people who get type 2 diabetes get it for the simple reason that their lifestyle is inappropriate. They're living an inappropriate lifestyle. They are way too much and they're not doing enough exercise. Why should you care about diabetes? Because diabetes is a disease that destroys arteries. That leads to a whole host of complications, the kind of things you just don't want to get if you can avoid it. Much higher risk of stroke, much higher risk of heart disease, higher risk of kidney disease, a leading cause of blindness, a leading cause of amputation. It's related to a higher risk of cognitive decline and dementia. You name the crummy condition, and it's more common in diabetics. And if that's not enough to convince all you guys to try to prevent diabetes by doing exercise and watching your weight, here's the final payoff. Diabetes is a leading cause of erectile dysfunction. Do what you will with that kind of information.